Joe's a 65-year-old dude who is awesome and has hip pain while sleeping in the front of his hip and his groin and his glute medius area. Enjoy the treatment today.
When you're working, you'd feel more like a pinch or like a stabbing, not like a dull.
Yeah, a pop, and it's the there's no predicting it.
Right.
I can't figure out what the movement or the motion is that causes that to happen.
What do you feel here? 3 fingers.
Just a little tiny bit of pulling in this right here.
0 to 10.
2.
So the reason why we're testing the left side, his range was about 8 inches.
Mm-hmm.
Last time we did the right side, it was about 11 with no symptoms, and he had right side symptoms with limited hip flexion on KG on the left. What do you feel here? 8 inches still?
Just a little bit of tightness, pulling in the quad there.
Nothing in here?
Nothing on the right leg.
Nice. How intense over here?
1.
Joe is a handsome 65-year-old man who has had right anterior hip and glute pain, groin pain for over a year when he was driving more than 3 to 4 hours per day. His concern was that it was getting worse and was starting affecting his gait, and he started limping. He was limping when he walked into the office. One of the things that I'm always concerned with when people are limping and he's in the 60 to 70-year-old age bracket and he has pain when he brings his knee in towards his other knee, and it causes symptoms in the front of his hip. So when you're kind of pinching the joint in different areas, is the labrum, the cartilage degenerated. So we did the full exam, and it did look like he had this snapping hip syndrome diagnosis. The internal one where there's a iliopsoas bursitis right around his psoas muscle around L3 where the belly button is. His psoas was as if I was making a bicep muscle and I was contracting really hard. His psoas was super contracted, and even after 11 treatments it was still very contracted. He's 90% better or so, and he is noticing weakness going upstairs. So we've been working a lot of his glute, hamstring, groin stuff, but now I'm thinking that I want to check his femoral nerve and his quads and see if there's anything really stuck or glued down in here. So his hip is extended, which is lengthening the femoral nerve right here to here. The femoral nerve comes close to crossing the knee. So she's flexing the knee, and then she's pushing the knee down to get more hip extension. So if you just imagine a string coming out L2, L4 here, coming down here, and then coming down the front of his thigh, and then it ends about right here, how do you lengthen that? So this shortens it, so lengthening it is bringing that down, and lengthening is bringing the knee flex. And so that's how we're tearing the adhesion around it. So femoral nerve is on this side of the anterior thigh, lateral femoral cutaneous nerve is on this side of the thigh. So you can get femoral nerve here, LFCN here, and both of these nerves can compromise the quads. And he's saying that he feels some stuff right in here.
Yep.
SHF is 2 fingers. What do you feel?
Just a little bit of pulling.
0 to 10.
2. 1.
Six.
Okay, we're gonna add 1. Single leg quarter squat. Hold on to something. Ideally, you have a little triangle here or a ramp so that your foot's in this position. I typically don't have one, so I just do them without bothering. This foot in front of the other, coming down, coming out. And you generally want to come down nice and slow. And just allow yourself to hold yourself there for a second and come on up. And so the thing with diagnoses like snapping hip syndrome or hip arthritis is it could be a combination of all this stuff. Thank goodness he had a lot of adhesion in his nerves, the femoral nerve next to the psoas, the obturator nerve in the proximal anterior thigh, the femoral nerve at the inguinal ligament, the superior and inferior gluteal nerve at his gluteal area, piriformis, the sciatic nerve at piriformis, which he actually had, which isn't super common. Thank goodness he had a lot of these adhesions because his symptoms were responding great. If you'd like to see more about how we fix chronic pain at Barefoot Rehab in New Jersey and with Adhesion Release Methods across the world, hit the like, hit the subscribe, and stay tuned for more videos that we will be releasing each week.